From NBC News World Headquarters in New York, this is NBC Nightly News with Brian Williams.
Good evening, I'm Ann Curry, and tonight for Brian Williams. Down to the wire now in healthcare reform. President Obama let loose today, giving a fiery speech on why it should pass. And if it does, we are also getting an idea about when the changes would kick in, how pre-existing conditions would be handled, and how children would be affected. We begin our coverage with NBC's Chief White House correspondent, Chuck Todd. Chuck, good evening.
Good evening, Ann. Well, the president and his staff like to say they live by the credo, no drama, Obama. But as this House vote on health care approaches this Sunday evening, the next 48 hours promise to be anything but drama-free. Delivering a revved-up, campaign-style closing argument.
Do not give up. We keep on going. We are going to get this done.
The president told an audience of college students in the Washington suburbs the stakes are high and that the time for debate is over.
The time for reform is now. We have waited long enough. We have waited long enough. And in just a few days, a century-long struggle will culminate in a historic vote.
Meanwhile, on Capitol Hill, where a final vote in the House is slated for late Sunday afternoon, Democrats sounded optimistic.
You know, a lot of momentum has built over the last day or so, and from what I hear, the wind will continue to blow out our backs throughout the day.
The president plans to keep up the pressure on Saturday when he heads personally to Capitol Hill to speak to the entire House Democratic caucus. Republicans remain united in their opposition.
The American people do not want any part of this. And if anyone thinks the American people are going to forget this vote, just watch.
And they are pushing back on this air of inevitability.
I just think it is clearly false momentum.
While there is urgency to this weekend's vote, the actual reforms, if passed, take months, years, even decades to implement. The first taxes go up in 2013, a Medicare payroll increase of 0.9% on income in excess of $200,000. The mandate for all Americans to have health insurance or face a fine begins in 2014. No denial of coverage for pre-existing conditions takes effect for adults in 2014, for kids immediately.
If this vote fails, the insurance industry will continue to run amok.
But some benefits would kick in this year. Insurance companies could not drop patients that get sick. Providers must offer free preventative care. Caps on lifetime benefits would be eliminated. And young adults could stay on their parents' insurance policies until age 26. But these final hours are not about the policy, but the politics, which may explain why the president returned to a familiar campaign refrain.
You've got to stand with me just like you did 3 years ago and make some phone calls and knock on some doors.
And when he got back to the White House today, a steady stream of Democratic lawmakers have been visiting him, including some folks who have been no votes. And by the way, Senate Majority Leader Harry Reid's going to join the president tomorrow on Capitol Hill with a letter pledging that the Senate Democrats will go through with reconciliation, Ann.
All right, thanks so much. Chuck Todd tonight. And for more on the politics and also for the fallout from this struggle over health care reform, we turn now to the moderator of Meet the Press, David Gregory. David, just how close is the president to getting the 216 votes he needs in the House?
Well, he's very close, but I spoke to a top Democrat in the House tonight who said, quote, "We're going to have to dig this out. It is a scrum. It is hand-to-hand combat in terms of persuasion. The Speaker, Nancy Pelosi, has in some cases gone to members 10 times in order to try to close the sale. And as Chuck reported, the president will be there in person to try to get it over the line. So it's very difficult. That momentum that you heard Representative Clyburn talking about in Chuck's piece refers to some of the vote switches that we've seen. No votes becoming yes votes. In just the last couple of days, that total is at 6. In fact, late word tonight, there's in fact a 7th no vote that's become a yes vote. Some of these folks include first-time Democratic lawmakers, members of the House, who are from tough conservative districts who are facing re-election. So all the more important to get them across the line.
Well, given the intensity of what's happening behind the scenes, David, what are the chances there are going to be some last-minute hitches leading into Sunday's vote?
You know, there are some real chances. There was the allusion that Chuck made to the letter. That was very important to House Democrats who don't trust that the Senate will necessarily follow through on voting for reconciliation. There's also this abortion language. There could be 3 or 4 members of the House Democrats who simply cannot vote for this until they maybe have a chance to vote on another resolution that would tighten up the abortion restrictions. So there are some potential hangups that are going to make the next couple of days very interesting.
And what exactly is happening behind the scenes? Can you give us a sense of what's happening?
You know, it's so interesting. The president in the White House today has most of his meetings on health care. There were a few other ones. Apparently, he rushed out of the Situation Room today to get back into the Oval Office to make more calls. There are members of Congress who are lining up outside the Oval Office. And again, House Speaker Pelosi also engaged in what one Democrat called the legislative grit right now, member to member, making the case that they have to trust her, that she'll be able to deliver, that it's safe to cast this vote yes.
All right. David Gregory tonight. David, thanks.
Thanks.
And there will be much more on the health care vote on Meet the Press. David's guests will be House Democratic leader Steny Hoyer and Republican leader John Boehner. And that is Sunday on this NBC station.